respiratory syncytial virus, and recurrent wheezing in the healthy preterm infants. Definition: only a lower respiratory tract that is caused by respiratory syncytial virus. In the most common causes of the hospital admission in the winter season during the first year of life. Severe syncytial virus bronchiolitis has been associated with an increase in the subsequent rate of early wheezing, asthma, and possibly allergic sensitization later in life. Early childhood with after syncytial virus infection has a high prevalence, influence quality of life, and generate subsistence health care costs.
RSV bronchiolitis is a serious threat to the health of infants and young children. Based on historical estimates, it is the leading cause of infant hospitalization as well as the leading cause of infant viral death. RSV lower respiratory tract infections lead to epithelial necrosis, with the loss of ciliated cells, smooth muscle constriction of the airways, goblet cell proliferation with increased mucus production, and parabronchiolar inflammation and edema. As a result, pulmonary function during RSV lower respiratory tract infections may be significantly compromised, leading to difficulty breathing and decreased systemic oxygenation.
Application in nursing. Nurses can work in various studies. In the double-blind placebo-controlled Mejia trial, with randomly assigning 429 otherwise healthy preterm infants born at a gestational age of 33 to 35 weeks to receive early monoplacebo injections 2014 infants or placebo 2015 infants during the syncytial season. The specified primary outcome was the total number of parent-reported wheezing days in the first year of life. Nasopharyngeal swab were taken during respiratory episodes for viral analysis.
Hi, I'm Dr. Aaron Gardner. I'm a pediatric intensivist and practice at the Pediatric Intensive Care Unit at Eastern Idaho Regional Medical Center. Today we're going to talk about RSV. RSV is the most common cause of bronchiolitis in children, and bronchiolitis is inflammation in the small airways of children. It is the most common cause for hospitalization in children under 1 year of age. In fact, as many as 75 to 125,000 children are hospitalized with it each year. As a physician, I consider those at highest risk for RSV to include really young infants, those born prematurely, and children with chronic heart or lung conditions. The symptoms of RSV are similar to other respiratory infections. These symptoms might include a dry cough, runny nose, low-grade fever, sore throat and decreased appetite, or a mild headache. Most of these symptoms in children resolve within 1 to 2 weeks, but in some children, particularly small infants, they may require hospitalization. In young infants, those born prematurely or those with chronic heart or lung problems, RSV infections can be particularly severe and even life-threatening. In severe cases, RSV can lead to lower respiratory tract illness or pneumonia. If your child develops any of these symptoms, immediate medical attention should be sought. These symptoms include high fever, difficulty breathing, blue discoloration of the skin, lethargy or excessive sleepiness, wheezing, or severe cough. In the most severe cases, infants may require supplemental oxygen, suctioning, or intubation and mechanical ventilation. Most cases of RSV can be managed at home under the direction of your doctor. Your doctor may recommend things like over-the-counter medications such as Tylenol to treat fever and discomfort. Aspirin should not be given to your children. A humidifier can be used to keep your child's airway moist and to help with congestion. A bulb syringe and nasal saline drops can be used to ease congestion. Encourage fluids and watch for signs of dehydration, such as low urine output, dry lips, and sunken eyes. Finally, avoid cigarette smoke as it can aggravate symptoms. Infection is spread by direct or indirect contact with the virus. Direct contact can come from kissing the face of a child with RSV. Indirect contact comes from coughing or sneezing or coming into contact with hard surfaces such as a doorknob. RSV is contagious for 3 to 8 days and can easily be spread to other family members at home. There are steps you can take to prevent the spread of RSV. These include covering coughs and sneezes, good hand washing, keeping hard surfaces clean, and not sharing cups or eating utensils. If you or your child are not feeling well with symptoms of RSV, it is best for you to stay home from work and school to avoid the spread of the infection. There is a drug available to prevent severe infection in certain high-risk children. It's called palivizumab. It is not a vaccine, but it can prevent the development of severe symptoms associated with RSV. If your child is experiencing any of these symptoms associated with RSV or you have concerns, please speak with your healthcare provider.
Another one. Yeah, I know. I know. So wake up. Let go. Let go. There you go. up, right? There it is. There it is. Couldn't find it. You did it pretty well last night, huh? Yeah, you did. Oh, honey. Good job. Good job. I know. I'd yell at me too. Keep going. Keep yelling. Pop in your That's it.
Pros and cons. It is proof of concept study treatment with a monoclonal antibody for sensical virus prevention in late-pregnant infants greatly reduced the number of sparring reported within days during the first years of life, even after the end of therapy and outside the sensical virus season. Sensical virus prevention reduced wheezing, but wheezing was not eliminated. Sensical virus prevention was associated with a relative reduction of 61% in the number of wheezing days, a finding that showed that sensical viral infection is an important mechanism in the pathogenesis of wheezing morbidity in the specific population. In Cevallos in Ecuador, a cross-sectional study was carried out determining the soil prevalence and risk factor associated with bovine respiratory syncytial virus infection in non-variant, dairy, and dual purpose, called here from Ecuador, and total of 2,367 serum samples for 1,346. Here we called from June 2008 to February 2009.
It's a common childhood illness that carries symptoms similar to a cold, and it usually strikes during the winter months. But according to a new study, respiratory syncytial virus, or RSV, may be striking a more powerful punch than previously thought. Here's more.
It's a common lung infection that comes and goes with young kids, usually without any lasting impact.
Runny nose, perhaps fever, they may cough for a week or two.
But new studies show respiratory syncytial virus, or RSV, may be able to hide in the lungs, even after the symptoms abate, and resurface later with more serious consequences.
We can't just say you had the RSV, you're over it, great, we can move on. Most cases that's going to be correct, but we have to be vigilant for the child who had RSV and now comes in with coughing or wheezing to think more about asthma and treat them as such.
RSV is the leading cause of viral respiratory infection and hospitalizations in infants and children worldwide. Half of all babies develop RSV infection within the first year of life, and practically all have had at least one RSV infection by age 3.
We're not sure the exact mechanism, but we think RSV makes the lungs more sensitive, shall we say. As a result, the lungs become more apt to get asthma, which is both narrowing of the airway and swelling of the airway. So we think the virus that causes RSV makes things more apt for that to happen in the lungs.
The new research contradicts current thinking that ribonucleic acid viruses like RSV are easily destroyed in the body. While there is no vaccine available, health experts say there are simple ways to protect your children.
Unfortunately, it's out in the community, so there's not absolute protection, but good hand washing. Making sure that when children are sick, they stay away from other children during the first couple of days of illness.
For World Health News Today, I'm Judy Alley.
When you think health, think IRU.
Conclusion. In always healing preterm infants, polysoma treatment resulted in an insignificant reduction in wheezing days during the first year of life, even after the end of treatment. This finding implicates syncytial virus infection as an important mechanism of recurrent wheezing during the first years of life in such infants. funded by Abbott Laboratories and by the New Orleans Organization for Health Research and Development, making control clinical trial numbers.
And now, Healthline with award-winning medical correspondent Phil Rainier.
Welcome back. It's a virus that can kill babies, and doctors are seeing a lot of it in Louisiana right now.
I was very scared. I thought my baby was dying.
Mercedes Ramirez is talking about 9-week-old Fatima, her baby. She has respiratory syncytial virus, a wintertime illness that's no more dangerous than the common cold to healthy babies. But for preemies, infants with underlying conditions, or lung problems, RSV can be deadly. Doctors say it's important parents know when to get their at-risk babies emergency treatment.
If the baby has symptoms of, fast breathing or difficulty breathing, then that would be the time to bring the baby to the ER.
Fatima is doing well now. Tonight in Healthline at 10, what parents can do to protect their babies against RSV, which for some could include a vaccine.
New figures show the number of Louisiana babies coming down with a potentially deadly virus is on the rise.
It is called RSV. Tonight in Healthline, Phil Rainier tells you what you need to know to protect your child.
9-week-old Fatima Ramirez may be a little unhappy, but she's doing well compared to when her mom brought her to the hospital.
She had a lot of mucus built up and phlegm, coughing a lot, difficulty breathing. I thought my baby was dying.
Fatima's recovering from respiratory syncytial virus. In healthy children, RSV generally isn't considered dangerous. But for preemies, infants with underlying illnesses or lung problems, it can be deadly. RSV symptoms include runny nose, coughing, fever, and in some cases, difficulty breathing. Doctors say it's important parents know when to get babies with RSV to emergency treatment.
If the baby has symptoms of, fast breathing or difficulty breathing, then that would be the time to bring the baby to the ER.
Fatima's gonna be okay. Her mother spotted symptoms of the virus early and got her the treatment she needed. It's something doctors hope all parents will know to do when or if the time comes. With Healthline, Phil Rainier, WAFB 9 News.
And to learn more about RSV, you can go to the links mentioned section of our homepage at WAFB.com.
Thank you.